guys, welcome back to Medical Coding with Blue. Today's episode is all about, can you be a medical coder without a medical coding certification? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got this question the other day from the comments. Thank you to the viewer who made the request for this video, and here we go. All right, so can you be a medical coder without being a certified medical coder yet? Yes, you can. There's times when employers will say we will take education in lieu of experience, and sometimes they'll say, well, you know, if you've completed a program and you're going to take your certification within 6 months or a year, that we'll go ahead and hire you on, depending on, you know, what other requirements they have. You may be able to start that way. Now, if you start, just keep in mind that you may not make what a medical coder makes, okay? Because technically you don't have a certification. You've not fulfilled that whole spectrum yet of becoming a certified medical coder. So that's something that you have to keep in mind. And sometimes when they say, well, you know, we'll hire you on, and then when you get your certification, we'll move you up in the pay scale. Sometimes they will make good on this promise, and sometimes they won't. It won't be much of a difference from what you started with. So that's another thing that you have to keep an eye on. But if that's the case, you're certified now, you can, and you have experience, you can always go someplace else. Okay, so that's another thing. Don't feel obligated to have to stay there when you've got your certification and the company didn't make good on its promise to give you a raise. Once you got certified, you're free to go anywhere else because you don't owe them anything. These companies are going to look out for what is good for their company. It's the same way that you have to look out for yourself and what is good for you, okay? So that's the thing that you have to remember when you're out there and you're working. Although I will tell you, do not leave that job until you have another job lined up, okay? You never leave without having another job lined up or another way to make money, okay? That's very, very important. When it comes to working in medical coding, it is very difficult for new medical coders in the beginning. Everybody knows this because everybody wants experience. You can look at the job listings and see that. And they want you to have experience because they don't want to have to train you. There are so many fast-paced medical coding programs out there that are pumping out medical coders that are ill-prepared for the real world. So that's why they don't want to have to mess with it. But if you are very studious and you have been applying yourself, you've been learning, you can get in there, but you have to be very persistent. And so that's something that you have to know. And the other thing is showing when you get your certification, this shows that you have commitment to the industry because it takes investment, not something that they're doing, but in what you're doing for you professionally. We have to be able to maintain our certifications with continuing education units. The 4 main medical coding certifications: the CCS, the gold standard of medical coding credentials; the CCA, the certified coding associate; the CCSP, the certified coding specialist physician-based; or the CPC, the certified professional coder. These are the 4 main medical coding certifications. The first 3, CCS, CCA, CCSP, these are all with the American Health Information Management Association. The CPC is with AAPC. So these are the ones that that employers are looking for in the industry. So when you get these, this says that you have that competence to be able to be out there coding. And so that's something that if you can get hired on before you're certified, that's a great thing, because you will have more time in the field and you'll be actually applying codes, which is quite helpful when you are going to go sit for your certification exam, because those that have been in the industry for a while have greater chances for success when they sit for their first certification exam. So that's just something to keep in mind. It's a great thing to have experience beforehand. If you don't, it is okay. There's plenty of people who did not have experience before sitting for a medical coding certification exam and they passed just fine. So it really all depends on you. It depends on how much you're studying, and it depends on how much you're committed to this, because somebody without a medical coding certification is going to have to show up a lot more of their education, of their educational background, and their skills that they learned along the way in other positions, because that's what's going to kind of keep you at pace with somebody who is certified in medical coding already. So it's not about trying to compete, because there is going to be times when there's going to be people that are better than you anywhere you go. There's always going to be somebody who's going to work harder than you. But that's not a reason to give up, and that's not a reason to be discouraged. It's a reason to be encouraged, okay? You always want to put your best foot forward. You always want to make sure that you are trying to get where you need to in your career. And getting certified is supremely important because, again, it shows a commitment to the industry. And you are going to be forced to stay on top of all the changes. Whereas somebody who is not certified yet may not stay on top of those things. And some people do. I mean, it really all depends. And sometimes these places where we'll say, like these doctor's offices or hospitals that don't really know, they'll say, well, you know, we don't really need certified medical coders and that kind of thing. Yeah, you do. You do need certified medical coders, because we're the ones who are trained to understand the coding rules, the coding guidelines, and the updates. And that is very important, especially for the health of a facility, as far as like their ethical health, their privacy and security health, you know, that kind of thing, release of information, all of those things. It's very important to have people in there who know those things about the industry, the health information industry, because messing up in any of those categories can be catastrophic for a hospital, you know, or even a doctor's office. You never want to be a facility that gets caught up in all that, because it's important that we all know. That's why we all have training in HIPAA. That's why we know better than to release private information without making sure that it is being released appropriately, and, you know, who it's going to, and who's making the request and that kind of thing, or, you know, coding properly and making sure that all of the rules are followed and all of the updates are, you know, updated somewhere along the way. That's why we have a very important job. But again, it is going to take you to make sure that you study. And even though that you've gotten the job and maybe you think, okay, yeah, well, I'll get my certification, or I'll put it off, or, you know, well, they told me that I had a year and now I'm at 9 months, and so now I'm going to schedule my exam, but I don't know and I haven't been studying. Guys, come on, don't do that to yourself. If you know you have a deadline, make sure that you give yourself enough time to be able to meet that deadline. You know, if you know that they're giving you a year to get certified, and you say, okay, well, I'm going to spend, 5 months studying, because, you know, I've been doing all these things and I'm learning everything at work, and so this should be a good time for me to go ahead and start, getting myself scheduled at that 5-month mark. And so if anything happens when you take your test at that 5-month mark that you've been there, and perhaps you don't pass the first time, maybe that you have to take the certification exam again, that will give you enough time to take an additional 3 months to be able to run at it again and take the test again. Now, the reason that I say to wait 3 months between tests if you fail the first time is because with the American Health Information Management Association, there is a 90-day cooling off period, basically, before you can reschedule your test and sit again for the exam. You have to wait 90 days. I think this is a good time to be able to go back to the drawing board and be like, okay, I'm going to study again. And this advice applies to, AAPC folks as well. If you're trying to sit for the CPC again, I've heard of people, they fail the CPC and they immediately want to schedule it as soon as they can, like within a month or so, and they want to take it again. I don't think that that's a good idea, because if you fail that exam, even if you fail only by a few points, it doesn't mean that you couldn't, use a little bit more time to study harder and to be able to really pass. because you don't want to just barely pass. Yes, a pass is a pass is a pass, but you don't want to just barely pass a medical coding certification exam, okay, without really trying to get in there and figure it out, because what that score says is how much you're comprehending what's happening. And if you've been working and you still are not passing that test with a high score, then there's something that's wrong, and so you want to make sure that you pass it at a really good score. And if you've had experience, you've been coding for 5 months, you should already be okay, like, I can do this. and being a nervous test taker has nothing to do with it either, guys. A lot of people will say that, well, Blue, I'm just a nervous test taker, I don't like tests. Nobody likes tests. But if you've been studying, if you've been working with the workbooks, if you've been taking the time to work through those practices like you are supposed to, that test anxiety, that test fear is not going to be a big deal to you, because this is going to be something that you know and understand. And that's the thing that I keep talking about over this last couple of weeks, is that people make a big deal about things that they don't need to make a big deal about, especially if you've been studying like you should. If you've been studying like you should, this is going to be second nature to you. And so that way you can go into that testing center with more confidence. And if that's what you're waiting for, is that confidence, it's not going to show up like, a big balloon, okay? It's not going to be like, oh, hey, here's your confidence here, and this is this is what it's like to be confident. No, that comes through hard work and practice. And that's the thing. There's a lot of people that want to sign up for these test preps, right? Before they go and take their exam, they think that they need to spend all this money to be able to go through this particular course, and then, oh yeah, I'll be able to pass this test. There's a lot of people that go through those tests, those prep programs, that sometimes they don't do so well either, okay? So it's not a guarantee. If you're trying to think that, going to one of these programs is going to be a guarantee that you're going to pass a test, you're wrong. Because those prep programs for the exams are only meant to be like, okay, this is basically a review of what could potentially be on that exam. Because none of those practice questions are going to be on the exam. So there's really no sense in trying to memorize everything and think that you have to come up with all of this stuff so that way, you can pass this test. That's not it. I'm just saying. So that's the thing that if you're waiting on that, it's never going to show up. It's just going to take you practicing and making sure that you understand, reaching out, finding a mentor or finding a tutor, so that way they can help you for those things that you're truly stuck on. All right. That's just something that you ought to know. When it comes to getting certified, it is awesome, and it's going to unlock so many doors for you, and having experience also as well. But getting that certification, it can lead to so many more opportunities for you that you never even considered, and so that's just something that is just very important. And the great thing about health information and the health information industry is that you do not have to have a college degree in order to do really well in this field. The only reason that you should pursue a college degree is if you want to be in leadership or if you want to be an educator. Those are the two main reasons that you should be pursuing a degree. You should not pursue a degree if you want to be just a medical coder. Medical coders do just fine having their certifications, and they do very well. And sometimes just having a certification, you can make more than a degree holder depending on what the degree holder is doing. Sometimes if the degree holder is a coder just like you, think about it. They paid more to become a medical coder than you did when you just got a certification, right? A lot of times. Sometimes, I don't know. Some of these programs, they charge the same thing as a degree, sometimes even more so, just for teaching for a certification, which I think is ridiculous. And especially if you take the time to do your research, you'll be able to know that you can get quite a good deal to learn medical coding, and it's not going to take the amount of money that it would take to get a degree, and that's just something that I wish more people would make sure that they would do their research on before just blindly pursuing the degree. Because sometimes people will say, well, Blue, I pursued the RHIA because I want to be a medical coder. Why would you do that? That's not what the purpose of an RHIA is. The purpose of an RHIA, Registered Health Information Administrator, is to be an administrator of a department, of a hospital, of any of those things, of a clinic, because they are meant to manage folks. They are meant to, educate folks and make sure that they are compliant with everything in law and ethics, because that's what they do. That's what they're trained in. The medical coding portion of the degree programs, whether you're going for the health information technology or the health information management, is very small. It is almost insignificant compared to everything else that they have to learn. So if that's what you're thinking, that you need a degree, you do not. This is not that industry where you need a degree to be able to do what you want to do. You can do plenty just having a certification. And again, you do not have to go through a formal program to do that. But again, if you are wanting to start in the medical coding field and you don't have your certification, you can certainly do that. It may be a little bit harder, but it may be easier depending on where you're applying. And sometimes, again, people don't understand what medical coders do. So if you're applying for a medical coder position and you say you went to school, and sometimes the people may not know that you need to have a certification, or that it's preferred that you do have a certification. A lot of times they just have no clue. Again, not everybody understands what everybody does at a facility. So that's something that you ought to know. But if you get hired on, get your certification, start studying right away, enjoy the process of learning while you're at work. So that way you can use all of that to kind of help you as well. Keep in mind that what you do learn at the workplace, though, may differ from what we've learned from the book. All right, facilities sometimes have their own rules depending on what type of facility it is. Sometimes they use certain modifiers. Sometimes they use certain procedure codes. So that's something that you have to make sure that you can kind of like put that in each category, right? Like, this is just this facility specific, so not a normal practice in medical coding. So that's something that you have to pay attention to. But it's a good thing, again, if you can get hired on without being certified as a medical coder. But make sure that you get that certification so that you can demonstrate your commitment to this industry. At least that's just my advice anyway. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye!